All right, Brad. The first goal after you had knee replacement is you want to get the knee bending as far as possible and straightening as far as
Right.
possible. Because what is being laid down?
Well, Bob, the body is trying to heal with scar tissue
Right.
to make it strong again.
So you're racing against it. You
Right.
know, now the knee will get strong,
hmm
but if you don't get the motion, you may never get it.
Range of motion comes first, strengthening next.
Right.
Bob and Brad, the two most famous physical therapists on the internet.
All right. It's important that we start right away, Brad.
That's right.
So when you're in bed, you can start by taking a cake pan,
Cookie sheet pan.
if that's all you have,
Make sure there's no cookies in it.
right, and put your feet in it. Don't eat after you've done this, but you can actually start going back and forth.
Right, because your knee is going to be very sore and very weak, so you want to minimize the resistance by using the cookie sheet.
You'll probably have to have somebody help you.
Yeah, or help yourself, but yeah, do what you can to get it moving.
Another option, a better option, Brad, is to use the knee glide.
Sure. So you can adjust it and put your heel on there, and this slides effortlessly. And when you want to straighten it, you can do a little push down
Right.
on your thigh, pull up on your knee, take a belt from home, or if you have a stretch strap, these work better because there's loops in them, but you don't have to have one. A belt will work. You can go around like this and do that under here and pull. Get your hands in the strap so you don't, especially if you have arthritic fingers, this is a saver. Bob, do you want to hook that onto my
Sure.
toe? This actually works very nice to put it right around the foot and put it right in there. Get your hand in there and work it that way. Very
The
smooth,
thing
Bob.
that we know is you want to be in control, right, Brad? You don't want somebody pushing on that knee too much because it'll hurt.
Right. As a therapist, we've done that many
Right.
times, and the patient becomes anxious because
And they tighten up.
yeah, they tighten up so it goes less because someone else is creating
Right.
the force versus them being in control.
In control.
That's right. Look, look, Bob. It says Bob and Brett on there. Son of a gun. Okay, in the seated position is another way you can really work the range of motion. As a matter of fact, this is, in the therapy room, this is where we do most of it, I would
Right.
say. Again, if you're at home, if you have carpeted floor, you can take the cookie sheet. I think this is a cake pan, not a cookie
Right.
sheet. Want to be correct. Put it down, and that'll act as a nice slippery surface. And
If you have a tile floor, you could just put a washcloth down.
yep, a nice shiny floor, and you can get a similar advantage. And one thing that's important that you can do to help, so let's say I only get to here, and you want to get to that 90 degrees or 120 are very typical goals. The other leg over the top, I'm going to push. Oh, it hurts. And if you're having a knee replacement, you know exactly what I'm talking about. Also, Bob mentioned earlier, make sure you work on straightening it as well.
Right.
So
both
that's
both
critical.
ends.
Yep. Hands above the knee, a little pressure down.
Again,
and
let's show a better option, Brad.
Yep. We've used this for years
Right.
and other options, and we really, this is not working very well.
It's
Let's
not
get something-
ideal.
It's something that works in all situations, and so that's why we use a knee glide. So again, much easier to use. You get the same overpressure here.
We have found we get better results.
Yeah. And we're going to do this. And one big advantage that the knee glide does have is you'll look, there's a little handle
Got
here.
stilts.
It works
Yeah.
as a stilt, so you can have an incline and you can go downhill, which makes quite a difference. It just fits the body. The ankle tolerates it as well, and the knee you can go down. And once it gets stronger, then we like to work the hamstrings, which are neglected oftentimes. And going up this little incline really puts a stress on the hamstrings more than you would think, even on a healthy knee.
I'll tell you what, Brad. Flatten out once
Flatten it.
and go back, not around the ankle, but actually push off the toe.
Yeah. You mean of the
Right.
Yeah.
Yeah.
Yep, and that even
The
gives
toe
you
of
yeah,
the device.
exactly,
Right.
Bob. Good point. All right, and it's very light, 3 pounds.
Right.
Oh, I almost smashed your finger with that 3 pound unit.
All right, Brad, we've done lying down, we've done sitting,
Yes.
and now we're going to do standing. Functional.
And we're going to use the steps, which I've used this with many, many knee replacements.
Right.
They have stairs at home. It's really nice if there's handrails on both sides for safety. And they might start here and just start going the first step, and you rock forward, stretch, 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 and back. Once this gets easy, and you do 10 to 15 of these, you simply go up one level on a step. Again, grab here. And what I always have people do is rock forward and then also go up and down. It gives different stretch to the knee. Do whichever one works better for you. Sometimes you combine it, and you'll know. The person will feel it. It's a nice way to take advantage
Not
of.
too much pain.
No, not too much, but stretch. Not too much, but stretch. That kind of rhymes. Okay, now this is something at the end of every treatment. This is one thing we'll do with patients to straighten their knee out as well as cool it.
Provide comfort.
Right, so we're going to use a cold pack. So I got a nice gel pack here. In a seated position, again, get a stool about this height. And early on, you'll put the stool here, and it won't bend so
Right.
much. Put a cold pack over it. The weight of the cold pack actually helps straighten it. As it gets too comfortable, I know I always go out to my patients. It's not like you're too happy, so I push this out a little bit, more pressure, and then it stretches, and then they say, "Oh, thank you," in that kind of cynical way.
Not really.
Yeah, and then as you get out, it stretches more. Another trick you can do is take your toe and rotate it out this way, and then the pressure goes on the joint slightly
A
different.
little different angle.
Yeah, and that can be the trick to getting that extra few degrees.
So it's really just gravity, right, Brad?
Gravity, extra weight from the cold pack,
Right.
and just this position. Just wonder weight, about 15 to 20 minutes
All right.
on people.
A different option. You could actually in bed put your. I need the cold pack, Brad.
Oh, the cold pack. Sorry, I was kind of
So you go
excited
ahead
to
and put
throw it.
your on a roll towel. You put your heel, and you're actually straight all the way. But if you don't straighten, you actually just sit there like this.
Yep.
And you put the cold pack on there. And this doesn't look like it's bad, but if you have a total knee, it could be a lot of stress.
Right, and the idea is don't make it so stressful that it's really painful because then you tighten up. So you want to get that medium stretch, and you can adjust that by where you put the towel. Get a stretch so it's stretching but not making you cry.
You want to relax.
Yes.
Well, there you go, Brad. You want to make your surgeon happy. You want to make you happy.
Right.
You want to make people around you happy. Bend that knee, straighten that knee.
Right. It's definitely the key to success. We've done it on thousands of patients, and one way or another, Bob and I can fix just about anything except for.
A broken heart.
Yeah. And the knee is not that, well, it is kind of far from the heart. So anyway, forget that. Good luck.